Good afternoon, everyone. My name is Osinachi Wachuku. I'm here today to present my journal club presentation. And today I'll present the journal with the topic Safety and Effectiveness of Besogliflozin in Patients with Type 2 Diabetes mellitus, stage 3A, and stage 3B chronic kidney disease. And this study was presented in the American Journal of Kidney Disease. It was published in May 14, 2019, and it was funded by Pericus Sub LLC. As you can see, I've outlined the authors of the study. Now, in subsequent slides, I'm going to touch on besogliflozin. I'm going to talk a little bit on diabetes, and also talk about the chronic kidney disease, so we can see how all this relates and how this applies to the study that we're currently looking at right now. So besogliflozin it's still a novel drug, so it has no brand name yet. It's still under clinical trial. So it has a research code of EGT001442. It's a sodium glucose cotransporter 2 inhibitors, and it's a relatively new class of drug recommended for people with type 2 diabetes. Now, type 2 diabetes mellitus is a chronic condition which affects the way the body metabolizes glucose. The body either resists the effects of insulin or doesn't produce enough insulin to maintain normal glucose levels. Now, type 2 diabetes has no cure, but typically most people who have type 2 diabetes, they either maintain diabetes medication or insulin therapy, and better yet, they're advised to have a tweak in their diet and their lifestyle as well, by incorporating exercise. Stage 3 chronic kidney disease. As a person with stage 3 chronic disease has moderate kidney damage. The difference between the stage 3A and B is as a factor of the glomerular filtration rates. We can say in stage 3A is 45 to 59 milliliters per minute, and stage 3B it is 30 to 44 milliliters per minute. Treatment of chronic kidney disease. Most people who have chronic kidney disease, they also put on blood pressure lowering medications. ACE inhibitors and RRBs are very popular ones. But mostly, just like diabetes, they're also advised to change their diet and also incorporate exercise as well too. Now let's take a look at this study. The study was done to examine the impact of besogliflozin in patients with substantially decreased kidney function, and to determine whether the HbA1c lowering efficacy was preserved despite reduced glomerular filtration rates. Now, why are they looking at this, you ask yourself? And that is because type 2 diabetes causes hypoglycemia, and hypoglycemia exacerbates the regression, or the progression rather, of chronic kidney disease. Now, most therapies in the market right now, they fail to address this association, this morbidity of chronic kidney disease, but until this research. And now we want to see if a glucose lowering medication would also be able to affect people who have the chronic kidney disease at stage 3A or stage 3B. It's a phase 3 double-blind, placebo-controlled, multi-center, multinational randomized trial. The study, 312 participants enrolled in this study in 52 investigative sites. The study was carried out from September 2016 to January 2018, and the investigative sites included the United States, Spain, France, and Japan. The inclusion criteria for for the participants who were involved in this study, they had to be either male or female with type 2 diabetes or with adequate glycemic control. They also had to have had a diagnosis of moderate renal impairment, body mass index of less than or equal to 45 kilogram per meter square. The methods for exclusion criteria includes a diagnosis of type 1 diabetes mellitus, women who are pregnant and nursing, and subjects who are receiving renal replacement therapy or who have undergone renal transplantation. In this study, there were two arms that we are comparing. So we are comparing the bexigliflozin with placebo. Like I mentioned earlier, we had 312 participants, of which 157 participants were in the bexigliflozin arm, and then we had 155 participants in the placebo arm. And 20 milligrams of bexigliflozin was given to the participants on the bexigliflozin arm for about 24 weeks. And the same goes to the placebo effect as well too. And then this was compared with a baseline at the 24-week period. So what the outcome we expected, we wanted to measure the difference in the HbA1c levels. Now we want to see if there's a decrease or if there's a decrease or increase after giving 20 milligrams of bexigliflozin for 24 weeks. That's the primary outcome. Secondary outcome included change in body weight, change in systolic blood pressure, and also change in HbA1c levels at 24 weeks in patients with stage 3A chronic kidney disease and stage 3B chronic kidney disease. So the major statistical analysis just for this study was the ANCOVA, which is the analysis of covariance. It was just to generate the estimates of treatment difference at 24 weeks. And all analyses were performed using the SAS version 9.3. Now let's look at the results. We had expected from previous research, we know that SGLT2 inhibitors, they reduce glucose levels for diabetes, but we never knew, or there's been no research, or a lot of research to see if they also did for patients with stage 3A or stage 3B chronic kidney disease. This is about one of the first research that has done this whole test. So what we see here is that the participants who were treated with bexigliflozin had a mean reduction in the HbA1c as expected of 0.61%, and when compared to the placebo, we see a reduction of 0.24%. And moving on to patients or participants who had diabetes with also stage 3A chronic kidney disease, we saw a reduction of 0.65% compared to placebo in this arm. We saw a reduction of 0.34%. Now, participants with stage 3B chronic kidney disease, we saw a reduction of 0.59% when compared to placebo. We saw a reduction of 0.16% with a p-value of 0.02. Other endpoints that we observed in the end of these results, we also seen that the body weight was reduced compared to placebo. We saw an average of 1.61 kilogram body weight reduction. We also saw the bexigliflozin also decreased the systolic blood pressure by 3.8 milligram mercury. We see that bexigliflozin also decreased the fasting plasma glucose levels by 0.76 millimoles per liter with a p-value of 0.003. Now, looking at all the results that we've attained from this trial, the author of this trial concluded that bexigliflozin produced a statistically significant and clinically meaningful decrease in HbA1c levels. Treatment with bexigliflozin also produced a reduction in body weight, systolic blood pressure, fasting glucose, and albuminuria. The effect is more pronounced in patients with stage 3B chronic kidney disease. The strength of this study, the sample size was moderately large. It was a randomized, double-blind, placebo-controlled international study. The weakness, though, is that there was not enough data to support the long-term evidence that bexigliflozin is safe and effective without any serious adverse reaction. Now, we have seen that the primary endpoint was the reduction in HbA1c levels, but we had also seen a reduction in body weight and also a systolic blood pressure, and this could be due to caloric wasting and proximal tubular diuretic effects that results from the increased urinary glucose excretion. We can see that bexigliflozin, according to the trial, was well tolerated, although there were some adverse reactions such as genital mycotic infections, which were found in the study. This is just a summary of the study, you know, and here my reference. Thank you very much for your time.